Hello and welcome to UK Fitness Hub. My name's Travis Tarrant and today we're going to be talking about labral hip tears, what they are and what you can do if you've got one. Let's get into the video. Okay, so let's get straight into it. So in my hand here is the thigh bone, and right at the top is what we'd call the femoral head, so the head of the thigh bone. So that's that circular shape you can see up here. Now you can see the femoral head is going into the socket of the hip, and the socket of the hip is known as the acetabulum. Where does the labrum come into all of this? Well, the labrum is the outside piece of cartilage that goes around the rim of the acetabulum, and the whole point of it is that it attaches the femoral head into the socket. So think of it as being a little bit like a rubber seal. The other thing that we need to bear in mind is most injuries happen at the anterior superior part, which is the front part here. And when it comes to cartilage injuries, unfortunately it's not like muscular injuries where we can just wait and it gets better. Once you've injured cartilage, unfortunately you've injured it. Now that doesn't mean that there's nothing that we can do, but there certainly is a limitation on what we can do. So what causes a labral hip tear? Well, 3 reasons, and they're not just limited to these 3 reasons. It could be an impact injury, for example a car crash, sporting injury, so somebody that's gone into an excessive range of movement or done a movement really quickly with excessive force. And it could be genetics, so somebody with a shallow hip socket, for example. One of the things you'll notice if you was to search, trying to remedy a labral hip tear, that lots of physical therapy videos will come up. And you might be thinking, hang on a minute, you told me cartilage can't be fixed, so why would I even consider physical therapy? And the whole point of physical therapy with a labral hip tear is that you strengthen up the muscles surrounding, so the hip muscles, and you try and take the pressure off the joint. So if you have really strong, well-working hip muscles, it can alleviate some of the symptoms. And for those of you with mild symptoms, it might be really good to exhaust physical therapy and the whole avenue of physical therapy before going straight down the surgical route. There's 2 things we're going to do. One is exactly that. We're going to go through some hip strengthening exercises to try and take the pressure off the joint, but not to heal the torn labrum. And the other thing we're going to do is we're going to go through a warm-up. So if I could take you back to earlier where we was talking about that ball and socket joint, the acetabulum and the femoral head. Now, when the femoral head moves in the acetabulum, it's a ball and socket joint, there's a secretion of synovial fluid. And this is the fluid that allows free and easy movement through lubrication of the joint. So what we're going to do is we're going to go through a warm-up to get that synovial fluid secreted before we then go into the exercises. If you was doing a run, you'd do a warm-up. You wouldn't just go straight into sprints. And it's exactly the same principle with what we're going to cover in the video next. For the first 2 of our warm-up mobilisations, start on your back with one foot in contact with the floor and the other raised. In the video, I'm trying to make a semicircle shape, bringing my hips down, curving my hips out and away from my body, and then back in at the top. When I curve my leg back in at the top, I'm making sure that I don't bring my knee beyond the centre line of my body. A good and easy way to think of this is if you was doing your right leg, for example, try to make a capital D shape. Continue this for 30 seconds and you should start to feel the hip getting warmed up and fatigued. For our second mobilisation, I want you to start doing figure 8s. During these movements, the whole point is to get synovial fluid secreted from the membrane, which will allow the joint to become heated up and more readied for the exercises that will follow. These first 2 mobilisations should not cause you any pain, so test on yourself which range of movement feels comfortable and stick only within pain-free areas of movement. Like the first mobilisation, complete for 30 seconds once over. Let's now get into the exercises. We're going to start by strengthening the hip in all 4 planes of movement. And first up is hip abduction, which simply means bringing the leg and hip away from the midline of the body.
I'm using a looped resistance band here, but you can do this with no weight, or alternatively use a long resistance band and tie it to an object and then around your ankle. Hip abductors are often forgotten muscles, but they're crucial for our ability to be able to stand, walk, and rotate our legs. If you find this exercise difficult on balance, you can hold onto an object whilst you do it. However, try to work up to doing it unassisted in the future. Complete 15 repetitions on both legs for 3 sets. The second plane of movement we're going to target is hip flexion. With your body straight, bring one leg out in front of you directly forward whilst keeping a straight knee. In this exercise, you're strengthening the hip flexor muscles such as the rectus femoris and iliopsoas. Try to complete 15 slow repetitions under control with each leg for 3 sets. The third plane of movement is hip extension. Again, I'm using the band here. This time though, I'm keeping my legs straight and kicking back. You should begin to feel this in the hamstrings and glutes. The importance of good hip extension and strong glute and hamstring muscles are they help to maintain strong pelvic alignment and support the lower back. Again, complete 15 repetitions for 3 sets on each side. The final plane of motion is hip adduction. Now, I didn't have a TheraBand or a long band for this one, which is what I would recommend using. However, I'm demonstrating here on a cable machine so you can at least see the movement. Hip adduction means to bring the leg towards the midline of your body. In this case, I'm bringing my leg towards my body, beyond my standing foot, and then slowly back. Make sure the movement is slow and controlled, and that you're standing up straight and not leaning forwards. This movement targets your adductors, which are located at the inner thigh. You guessed it, it's 15 reps again for 3 sets on each side. Exercise number 5 is a side lunge. Start off in a shallow squat position with both feet facing forwards, then begin to step out whilst maintaining a forward-facing foot position. You'll notice as I'm doing this, I'm not coming out of the squat position at all, which makes this exercise much tougher. As I bring my foot out, I slowly shift my hips towards the way I'm stepping. You can make this exercise harder by using a stronger resistance band or going slightly lower into the squat. Try to complete 15 repetitions on each side, back to back for 2 sets in total. Next up is squat sidewalks. Start in a shallow squat position with your feet at shoulder width apart and your hips back. Take a small step out to the side with one leg and then bring the other leg a small step in. Ensure that you keep the same hip width distance you started with between your feet at all times during the exercise. You should pretty quickly feel this in the glutes if you're going at a slow pace with correct form. I tend to find a timed target is better for this one to ensure the best quality of repetitions. So aim for 30 seconds, and as you do this and you get better at it, you can increase the time limit. So what I would do is I would do 15 seconds walking towards one way and then 15 seconds walking towards the other way. Complete a total of 2 sets. Exercise number 7 is a reverse lunge. Start by standing straight and bracing your core muscles. Then take a big step backwards with one leg and bend the other. You're looking to drop your back leg down as far as is comfortable and then push back up to return to the start position. Make sure that you keep your torso upright throughout the movement. You can also opt to alternate legs with your repetitions or do them all on one leg before switching to the other. There is the option, if you're struggling with balance, to hold on to something like I'm doing here. Pay careful attention to the position of my front knee. Notice how my knee never goes beyond the toes. This is really important to protect excess pressure going through the knee joint. Complete 10 to 15 repetitions on each side for 2 sets. Lastly, we have a single leg balance. If you're a little bit wary about doing this one, by all means do it behind a chair or an object that you can quickly grab onto for support should you need to. Balancing on one leg tests the stability of the ankle, knee and hip joints all in one. Take a runner for example. Runners need to be able to generate force quickly and trying to generate force quickly with unstable joints could result in an injury. Start simple and try to complete 30 seconds for 2 sets, then gradually over time start to build up.
And that concludes the end of today's video. Thank you very much for watching, and if you are in pain or discomfort, I really do hope you feel better soon. If you've got any questions for me, don't hesitate to contact me in the comments box below. And if you have enjoyed the video or learned something new, please consider liking and subscribing to the channel. By liking and subscribing to the channel, you're helping me reach more people to be pain-free with free educational content. You've been watching UK Fitness Hub. I'm Travis Tarrant. Take care, and I'll see you soon.